Dr. Spero, all eyes are on Japan. The athletes are traveling there, spectators are on site, but the Japanese government decided to declare a state of emergency. What's really happening there?
There's four main reasons. The first is that there's been a significant uptake in cases in Japan, especially in Tokyo. The second reason is that it's a relatively unprotected population with only 15% of the population being vaccinated to date. The third is that we have this curveball now with the Delta variant. And finally, the fourth is that the society, the culture in general has an overall discomfort, unease with COVID that's probably a little more significant than other countries.
Now, IHP's medical team is on the ground in Japan. What are some of the things that they're implementing to promote health security?
Yeah, so we have a number of clients that we're on the ground with, like Visa, Intel, Cisco, and several others. And these are all the things we're doing for them. It's really our virtual package plus our on-site package. So we're doing digital health screenings of all the attendees. We did at-home testing before they came, and then we do daily surveillance testing when they're there. We're doing daily temperature checks, symptomatic testing, both at the lab and then with rapid molecular testing on site. And then we have on-site medical support where we have an entire on-site medical support team with physicians, nurses, paramedics there to take care of any healthcare need that they may have.
For meeting planners watching what's happening in Japan, what would you suggest they do if they're on a tight budget and they have a meeting coming up this fall and winter?
I'd say the minimum basics, and I justify this because this is what's going on in corporate America as well. So a lot of meeting professionals attendees are coming from corporate America where they see this happening in their own companies. So they're going to expect you to do it. The first one is the daily health screening, the digital daily health screening on the phone with the attendees. The second one would be daily temperature checks, even though we know they're not foolproof. They're part of the standard package. And then I'd say, especially for meetings, that you're going to want to have access to symptomatic testing. Like I brought the case study in before, where a bunch of people come to the meeting with colds and flus, and you have to determine whether you have a cold or whether they have COVID. So at the bare minimum, I'd say those three things are really important.